Answering frequently asked questions on period clots. What are period clots? Period clots are clumps of blood and tissue from the uterus lining. They are dark red or brown and vary in size. Larger or frequent clots might indicate an issue. Why do period clots form? Clots form when menstrual blood flow is heavy, causing blood to pool and clot in the uterus. It's a natural process to regulate bleeding. Subscribe, like, and comment if this was helpful. How can I tell if my period clots are normal? Small clots early in your period are normal. Clots the size of a quarter or smaller are fine. Regular large clots? Consult a healthcare provider. What causes heavy periods? Heavy periods, or menorrhagia, can be caused by hormonal imbalances, uterine fibroids, polyps, endometriosis, or pelvic inflammatory disease. Certain medications and conditions like thyroid disorders or bleeding disorders can also cause heavy bleeding. Are period clots and heavy periods related? Yes, they are often related. Heavy periods can cause larger clots. Seek medical attention if concerned. When should I be concerned about period clots? Be concerned if clots are larger than a quarter. Frequent or large clots. Or severe pain, fatigue, dizziness, or shortness of breath. How can I manage heavy periods and clots? Use superabsorbent tampons or menstrual cups. Take iron supplements for significant blood loss. Hormonal birth control can regulate bleeding. Consult a healthcare provider for treatments. What are some common treatments for heavy periods and clots? Treatments may include hormonal therapies like birth control pills, patches, or hormonal IUDs. Non-hormonal medications such as tranexamic acid or NSAIDs can reduce bleeding. Surgical options might be considered like endometrial ablation or myomectomy. And don't forget iron supplements for anemia. Are there any natural remedies for heavy periods and period clots? Some find relief with natural remedies. Discuss with a healthcare provider. Herbal supplements like ginger, cinnamon, or turmeric may help. Acupuncture may help with menstrual pain. Hydration aids circulation and reduces bloating. Can period clots be a sign of a serious health issue? Clots can signal fibroids or polyps, causing heavy bleeding. Endometriosis, where tissue grows outside the uterus, can also be a culprit. How can I differentiate between normal period clots and those that might indicate a problem? Normal clots are small and occur sporadically. Problematic clots are larger, frequent, and linked to severe symptoms. Tracking your cycle helps notice changes needing attention. What should you discuss with your doctor if you're concerned about period clots and heavy bleeding? First, your menstrual history. Talk about the duration, frequency, and amount of bleeding, as well as the size and frequency of the clots. Mention any associated symptoms like pain, fatigue, or dizziness. Discuss your current medications, including hormonal contraceptives. Lastly, share information about your diet, exercise, and stress levels. Can hormonal imbalances cause period clots? Yes, they can. Hormonal imbalances can lead to heavy bleeding and clot formation. Conditions like PCOS and thyroid disorders disrupt normal hormonal regulation. This can result in heavier periods and more frequent clotting, causing discomfort. Is it necessary to get a pelvic exam for heavy periods and clots? A pelvic exam can diagnose the cause of heavy periods. It checks for structural abnormalities like fibroids and assesses the health of your reproductive organs. Can stress affect period clots and heavy bleeding? Yes, stress influences menstrual patterns. High stress disrupts hormones, causing heavier periods or more clotting. Mindfulness, exercise, and rest may help regulate your cycle. Can diet affect period clots and heavy periods? Diet can influence menstrual health significantly. A balanced diet rich in iron, vitamin C, and omega-3 fatty acids helps manage blood flow effectively. Are there any over-the-counter medications for heavy periods and clots? Options include non-steroidal anti-inflammatory drugs like ibuprofen or naproxen, which reduce flow and pain. Always consult a healthcare provider before starting new medication. Can birth control help with heavy periods and period clots? Yes, hormonal birth control methods like the pill, patch, or hormonal IUD can reduce heavy periods. They thin the uterine lining, decreasing bleeding and clots. What role do uterine fibroids play in heavy periods and clotting? Uterine fibroids are non-cancerous growths causing heavy bleeding and clots. They increase the uterine lining's surface area, affecting blood flow. Output. How can I track my menstrual cycle to understand period clots? Tracking helps identify patterns and changes. Use an app to log flow, clot size, and symptoms. Note start and end dates, clot size, and symptoms. Monitor changes for patterns needing consultation. Can endometriosis cause heavy bleeding and clots? Yes, endometriosis, where tissue grows outside the uterus, can cause heavy bleeding, severe pain, and large clots. How is menorrhagia diagnosed? Menorrhagia is diagnosed through medical history and symptoms. A physical exam, including a pelvic exam. Diagnostic tests like ultrasound or hysteroscopy. And blood tests to identify causes like fibroids or hormonal imbalances. What are the signs that period clots might be related to a bleeding disorder? Signs include very heavy periods or bleeding between periods, frequent nosebleeds or easy bruising, and a family history of bleeding disorders. Consult a healthcare provider for evaluation. Can irregular periods contribute to larger clots? Yes, irregular periods can cause larger clots. Infrequent or prolonged periods cause the uterine lining to build up, leading to heavier bleeding and larger clots. How can hormonal imbalances be treated to help with period clots and heavy periods? Hormonal imbalances can be managed with birth control pills, hormone patches, or hormonal IUDs. Lifestyle changes like diet and stress management support hormonal health. Medical evaluation is crucial for identifying conditions like thyroid disorders or PCOS. Are there any complications associated with untreated heavy periods and period clots? Untreated heavy periods and large clots can lead to anemia. They can also cause severe pain and fatigue. Underlying conditions like fibroids may worsen if not addressed promptly. Can lifestyle changes alone resolve period clots and heavy periods? Diet, exercise, and stress management can help, but may not resolve underlying conditions. Consult a healthcare provider for a comprehensive approach.